I'm Colleen. I'm going to do your assessment today and wash my hands. So what I would do first is I'm going to inspect your head and face. I'm going to inspect for color, temp, moisture, texture, any edema, bruising. Make sure your head is a good size and symmetry. Look all the way around. Make sure you have good midline position. I'm going to palpate your scalp and head for any abnormalities. Make sure there's, no depressions. Everything looks good. Any tenderness in your scalp whenever I palpate? Mm-hmm. Okay. All right, I'm going to feel for your temporal arteries. I love feeling that. Okay, and now your lymph nodes, your pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, anterior, deep cervical, posterior, deep cervical, supraclavicular, and those usually you shouldn't be able to feel unless you're having some inflammation or if you've had inflammation in the past. Okay, I'm going to have you do some central cranial nerve 5. Okay, so clench your teeth, smile, feel the sensation. I got a little piece of cotton. Tell me if you feel that. Mm-hmm. Feel that on your nose, on your chin. Okay. Okay, smile real big, frown, raise your eyebrows, puff your cheeks out, and purse your lip. Okay, I'm going to look at your ear. I'm going to inspect the outer ear for shape and position, make sure they're positioned on your head well. I'm going to use my uber cool otoscope here. I'm going to look, make sure I don't see any cerumen. Is that what the wax is called? Did you like that? And as I'm shining the light in there, on the left, the light should be at 7 o'clock position, and on the right, it should be at 5 o'clock position. I would pull your pin down and back, look for masses. Now I'm going to do the little Rene test. Well, with the Weber test first. So I take my tuning fork, stick it on the top, and tell me, do you feel that equally and hear it equally? Okay, and then I'm going to do the Rene. Place it back here for bone conduction. Tell me whenever it stops.
Okay.
And for air conduction, tell me when it stops.
Okay.
Okay, and I would do that on both sides. And now I'm going to do the whisper test. Tell me what you hear me saying. This is testing CN8.
Hello.
Hello. Okay, now I'm going to move on to your eyes. Inspect your eyebrows, your lashes, beautiful eyes. Check out your conjunctiva. Now, this is the Snellen test. I want you to tell me, cover one eye and tell me what that bottom line is.
D-E-F-A-C.
Okay, and cover the other line.
D-E-F-A-C.
Very good. Okay, now let me get my little light. I would dim the lights. This is the CN3 response to light. So I want to see how your eyes constrict. So look straight ahead. And I'm going to bring this light in from the side. I'm looking. And they should be equal for accommodation. And then follow the light and convergence. Okay. Now we got to do the wagon wheel, the EOM. So follow the light, not moving your head. Well, this pen thing. So. Very good. And the red reflex. I would use my optimal scope, something like that.
Up about
Come in and look for your red reflex And that is good, good eyeballs. Okay, so now we're gonna check out your nose. Have you ever had a broken nose? Do you have deviated septum?
I broke my nose.
Oh, okay. Were you in a fist fight, fisticus?
Softball.
So, okay, that's good too. Okay, check your maxillary sinuses. Tell me if there's any tenderness. Okay. All right, nose looks good. Let me check your mouth. Open up. Okay, and that right there was a test of CN 9 and 10. Everything looks good. Do you have any sores in your mouth? Okay. Let me feel your temporomandibular joint open and close. Good. Okay. Now we're going to move on to your neck, and I'm going to inspect your skin, color, temp, texture, edema, bruising, anything like that, any moles. I'm going to check your trachea, make sure it's in the midline. It's pretty smooth skin. I'm going to check your thyroid glands. I'm going to come from behind. I'm going to have you swallow. That's so cool. Okay, I'm going to palpate your carotid arteries. I'll do one at a time so that you don't pass out, okay?
Okay.
Isn't that sweet? That's so cool. And now I'm going to listen to it for any bruise using the bell of my stethoscope, which I just learned is cool. I just have to press. No bruise, you're good. Okay, testing your range of motion with your head. Can you chin down towards your chest and extend your head back and down and around. That feels good. Okay, I'm gonna check CN 11. I'm gonna shrug. Yeah, just like that. Against me. Okay. And 12, stick your tongue out. Very good. All right, posterior chest, I would inspect your skin all over again, color, temp, moisture, texture, edema, turgor, skins, lesions. Okay, I'm going to check for symmetry. Breathe in real deep for me. Perfect. Perfect. Any signs of respiratory distress, use of accessory muscles, none of that noted. No obvious deformities, you look symmetric. And tactile primitus. Say 99?
99. 99. 99.
Very cool. Okay. Now I'm going to percuss. Oh, that's really neat. Sorry. Get excited about these things. Okay. Now I'm going to listen. This is one of my favorite ones. Take a deep breath. And I'm going to listen side to side all the way down, being sure to listen to the right middle lobe. I would also check for egophony, which she would say E, and it should sound like a long E. Bronchophony, it should sound like you'd say 99,
99.
and it should be muffled. And then the whisper hectoroliloquy. Whisper 1, 2, 3. Very good. Okay, now we're going to move to your anterior chest, and I will check your skin all over again, the color, temp, moisture. This is where in elderly patients we would check their turgor right here. By pulling up the chin, no obvious deformities, you look symmetrical. Tactile primitus.
99.
And breathe deeply for me. Symmetrical. Expansion. Let me listen to your lungs. And take a breath. And I would compare down the anterior chest, listening for bronchovesicular, what is this down here? Wait, what? Help me. Vesicular. Thank you. I got lost. Okay. Now I'm okay. So I listened. Pause. Okay. Now that I've composed myself, I know where I'm at. I'm going to listen to your heart. This is aortic, pulmonic, Herb's point, tricuspid, mitral, and this is where I would listen for 1 full minute for the point of maximal impulse. I didn't know any extra heart sounds or murmurs. So now I'm going to, I would rate the rhythm or report the rhythm and the rate. Have her lay down and inspect for any heavy lifts, heaves or lifts. Palpate for any thrills over the same points. And then listen. Oh, I'm going to have you lay on your back first.
Oh, okay. That's comfortable.
And I'm going to listen again. It's so amazing. Okay, and then at this time I would elevate the head of the bed 30 to 45 degrees and look for any jugular vein distension. And then pause, because I already posted here. Okay, I would have my patient empty her bladder before I inspect the abdomen. Again, we would inspect the skin for any color, temp, moisture, texture, edema, turgor, all that good stuff. Look for any contours or asymmetry. I would also take for bruits over the abdominal aorta, the renal arteries, and the iliac and femoral arteries. Comparing both sides. Might as well just keep these things on in. And also take for vowel sounds, starting in the right lower quadrant. And moving around. Okay, now I would percuss the abdomen for tympany, any dullness or flatness. I would palpate for tenderness or masses, and palpate the liver and the spleen, which normally shouldn't be palpable. And at this time, you have survived. Thank you for being my patient.
Thank you.
And any questions? Do you have any questions?
I'm good.
Oh, okay.